Welcome back. So, in this longer video on potassium, as we cover what the normal is 3.5 to 5 and optimal 4.0 to 4.5, like we say, that much tighter range, what causes potassium to get out of balance? And so, when we look at this, we see adrenal stress, insufficient intake, diuretic use, hypertension. And those two kind of go together because you're probably taking a diuretic because you have hypertension. What causes excess hyperkalemia is dehydration. Are you not getting enough water in? So take your body weight, divide that by two, and that should be roughly the amount of good, clean water that you should take in ounces per day. Metabolic acidosis. This goes back to kidney damage. If your kidneys aren't filtering out the acids that are in the body, let's say you have kidney damage and you're drinking a ton of Cokes. And when I say a ton of Cokes, when you're drinking 1 to 2 a day, that's a ton of Cokes. So when you're drinking these things, your body needs potassium and calcium and phosphorus and all of these things to actually decrease or to take out the acid. And so when people have done studies on the blood work on the blood, you have enough of those minerals, enough reserve that you can basically filter out about 6 ounces of the soda. And so that still leaves you with 2 ounces to filter out. And this is an oversimplification, but you'll get the idea. Where do you think that your body is going to get the potassium, magnesium, and calcium that it needs to finish out taking those acids and making them bases so that you can excrete them out? Well, they're going to start to pull it from the teeth and from the bones and things like that. So, metabolic acidosis is nothing to be oh, that never happens. It does. But small variations on this start to, over time, create much bigger problems. And this is why we talk about lifestyle a lot. Cell damage. Are you getting into things that are causing the cells to die? Or do you not have enough good fats that your body can repair the cells? So when cell damage happens and the cell opens up, when that cell opens up and it starts to spill its contents, and all of these things go into the bloodstream, then all of a sudden your body has a crisis and tons of inflammation happens and cell death continues on. If you get blunt trauma and you bruise, and you ever notice how bruises, if you get just a pinpoint bruise, it's a circle. And if you get hit with something, like a bar or something, it follows that line, but then it goes out and then it starts to shrink back in. Well, that histamine response from the cell death causes a chain reaction and they all start to break down. Well, when you have that type of cell damage, it also causes excess potassium to be released into the bloodstream, and then the body has to clean that up. And then, last but not least, your adrenals are stressed to the point that they are not working. And so DHEA goes low, cortisol goes low. The body can't, you're tired, lethargic, you can't move, you can't do the things that you want to do because you just don't have the energy. Well, that's another thing that starts to wear and tear on potassium. So, what are some good, well, let's look at water poor forms of potassium. Well, first off, when they use it as a preservative for packaged foods, anything, anytime they use things like potassium or sodium as preservatives, it's typically a very poor form. It's the cheapest form they can find. It typically is a chloride form or a hydrochloride form. And these things are not absorbed well into the body. They cause the body to actually have to do more work. So, processed or packaged foods are absolutely horrible forms of potassium. They're not even really foods, and they cause stress on the system. Let's go into the next couple. These forms are typically forms found in poor vitamins. If you're taking a vitamin and it says potassium chloride, potassium aspartate, potassium phosphate, those are low quality forms, not really very bioavailable to the body, and they are not good for you. That potassium aspartate, especially, that's an excitotoxin that'll tax the kidneys as well as the phosphate. But the aspartate form is called an excitotoxin because it changes the where the junction of the nerve cells are, and it causes that to be hyperexcited, and it will cause cell death. So that is a really poor form of potassium. Good forms, well, look at your foods, your bananas, your avocados, cantaloupe, honeydew. You can read the list. I'm not going to read it to you. Those are whole food forms. You want fresh whole food forms because that's what your body through the millennia is used to seeing. Our bodies are not that much different than our ancestors' bodies. And so these are forms that the body has seen through the ages. And it's very absorbable, goes through the body, doesn't cause diarrhea and things like potassium aspartate or phosphate, so or chloride. So those are the forms that you want to have. And this is why we're always talking about a fresh whole foods diet. The fresher the food, the more you can pick that tomato off of the vine and eat it. That's the amount of vitamin C that's in that is 2 to 3 times the amount of vitamin C of your cellophane wrapped tomato at the grocery store. So, if you're having problems with your blood work being wonky and you can't get it figured out, that's what we're here to do. We're here to help you look at your lifestyle, get your lifestyle straightened out so that you can live the life that you want to live, not the life that you're relegated to because you don't have energy, because you feel like crap, because you can't think. Those are the things that we want to help you get through. Thank you.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in person and virtual consultations. Thank you.